Ladies and gentlemen, hello. Our project name is Clinical Key for Electrical Stimulation in Physiotherapy and Rehabilitation. It is funded by the Erasmus Plus program of the European Union. The project coordinator is Pamukkale University and the partners are University of Craiova, Hatay Mustafa Kemal University, Başkent University, Süleyman Demirel University, Şule State University of Applied Science, and Burdur Mehmet Akif Ersoy University. And associated partners are Turkish Physiotherapy Association, Order of Physiotherapists in Romania, Lithuanian Physiotherapy Association, and Estonian Association of Physiotherapists. My presentation is about electrical stimulation of denervated muscles in first 21 days. This chapter written by me, Fatma Nur Alçın, from Burdur Mehmet Akif Ersoy University, and Professor Nilüfer Çetişli Korkmaz from Pamukkale University. After the last fragments of the motor axon and the intramuscular nerve terminals disappear, the stability of muscle fibers decreases, and degeneration and fibrosis of muscle fibers occur. Even when there is a reinnervation of a muscle that has reached this point, a decayed contraction cannot be achieved. But if the motor point of such a muscle is stimulated by an electric current mimicking a nerve impulse, regular contraction can be achieved and atrophy could be prevented to some extent, and this is the good point. The amplitude and duration of the stimulation required to ensure the muscle fiber contraction should be increased as muscle stability decreases. For fully denervated human muscle, the minimum stimulation current time required to form a contraction is approximately 1 millisecond. Applications include galvanic and Faradic currents to achieve the optimal clinical effect. The galvanic current stimulates the denervated muscles, and the Faradic current stimulates the innervated muscles. In case of axonotmesis and neurotmesis of motor nerves, muscles and nerves don't respond to Faradic current, but the response could be obtained in the first 14 to 21 days because the degeneration state is not complete. Then, this response is interrupted, and this period of non-response continues until regeneration. In neuropraxia cases, there is a response to Faradic current because there is no degeneration in the nerve, and Faradic current is applied until regeneration is completed in training the paralyzed muscles. The stimulation should provide a moderate to strong contraction, but of course without unnecessary discomfort for the patient, and the stimulation should resemble the normal activity of the motor neuron. Both currents were found to be maximally effective in the 2 weeks following denervation. On the other hand, one of the important points is electrode placement. It is advocated to be made on the nerve body in order to make a greater contribution to the ignition of the motor unit. In addition, monopolar and bipolar practice could be made. In monopolar practice, the active electrode is placed on the motor point of the muscle and the passive electrode is placed proximal. You can see monopolar application to opponent's pollicis muscle in figure 1. You can see both of the starting position and ending position of application. In bipolar practice, electrodes are placed on the origin and insertion of the muscle group. You can also see bipolar application for forearm flexors in Figure 2 with starting and ending positions. One of the first animal studies on the use of electrical stimulation after peripheral nerve injury was done by Hoffman in 1950. In this study, it is observed that following the electrical stimulation application to the nerve roots, the reinnervation of the partially denervated muscle began with intramuscular axon supporting on the third day after the surgery. Another study was done by Hoffman in 1952. In this study, sinusoidal electrical stimulation at 50 to 100 Hz and a current of 1 to 5 mA was given to the spinal cord or sciatic nerve roots immediately after partial denervation of the sciatic nerve following cross-section of the L5 spinal cord root. It has been reported that this stimulation period significantly accelerates the onset of axonal sprouting. It is stated in the literature that currents greater than 4 mA negatively affect regeneration. Because excessive direct current is inhibitory for growing fibers. And also, electrical stimulation at a low frequency of 2 Hz and a current of 1 mA indicates a more mature nerve regeneration. An example of important studies conducted in the following years is the study by Puckett and Gavin. This study was done in 1985, and in this study, it was reported that electrical stimulation given at 1 Hz for periods of 15 minutes, 30 minutes, and 1 hour applied to the proximal of the crushed and impaired axonal continuity of the sciatic nerve had a positive effect on earlier recovery of the two extension reflex. And it was evaluated that the electrical stimulation of the crushed nerve has quite significant effects on the regeneration rate, although it doesn't affect the number of renewed axons. And it has also been stated that the most effective time for stimulation is immediately after crushing, within about an hour. In another study, repair was performed after femoral nerve incision. Immediately after the repair, 20 Hz frequency stimulation was applied to the proximal nerve root with an implantable stimulator for 1 hour, and this frequency was selected based on the average firing frequency of motor neurons in animals and humans. In this study, continuous electrical stimulation was applied for 1 hour, 24 hours, 1 week, or 2 weeks. And as a result of the study, it was stated that axon growth from both sensory and motor neurons of stimulated nerves accelerated for all application periods, and the axons of all motor neurons regenerated within 21 days. We talked about these two studies. In the first study, Puckett and Gavin found positive effects on earlier recovery of two extension reflex of electrical stimulation at 1 Hz. In the second study, Olmayet et al. Found acceleration in axon growth from both sensory and motor neurons of stimulated nerves for all exposure times and regeneration of axons of all motor neurons within 21 days. In these studies, the positive effect of short-term low-frequency electrical stimulation on supporting nerve regeneration in animal models have been demonstrated. Subsequent studies have focused on elucidating the effects of short electrical stimulation and the specific mechanisms responsible for axon regeneration based on these studies. And electrical stimulation has also been shown to regulate cellular activities such as cell adhesion, cell proliferation, cell migration, and protein production. There are also animal studies conducted in the literature on the effect of electrical stimulation combined with exercise on denervated muscles. One of them was done by Asensio Pinilla et al. In 2009. In this study, it was aimed to eliminate the role of neuronal activity induced by electrical nerve stimulation and exercise about promoting axonal regeneration and modulated plasticity in the spinal cord after nerve injury in rats. There were 4 groups in this study. Rats in the group 1 received only electrical stimulation treatment at 20 Hz, 3 volts, 0.1 milliseconds for 1 hour in a day and for a total of 4 weeks. Rats in the group 2 received same electrical stimulation treatment and also they received walking exercise for 2 hours in a day for a total of 4 weeks. Rats in the group 3 received only walking exercise for 2 hours in a day for a total of 4 weeks. And group 4 was the control group, so rats in the group 4 received no treatment. The study indicated that acute electrical stimulation and or exercise promote regeneration of the muscle more. But study also showed that the combination of electrical stimulation and exercise has more beneficial effect on the early stage of regeneration. There are studies in the literature examining the effects of short intensity, low frequency electrical stimulation on humans, and one of them was done by Gordon et al. In 2010. In this study, they worked with patients with severe carpal tunnel syndrome and thenar muscle denervation. Electrical stimulation at 20 Hz was applied to the surgical decompression area using wire electrodes for 1 hour after surgical decompression of the carpal tunnel. It was found that 1 year after the application, the stimulation group had a significantly higher number of motor units than the control group. And short-term low-frequency electrical stimulation is found effective in accelerating axonal regeneration in humans and enabling thenar muscle regeneration to occur faster. In another double-blind, randomized controlled clinical trial involving 31 patients with digital nerve incision, electrical stimulation at 20 Hz and 30 volts was applied to the digital nerves after nerve transection. In this study, significantly faster improvement in multimodal sensory functions was observed in patients receiving digital nerve electrical stimulation. For example, after 6 months, cold and hot detection thresholds, static 2-point discrimination, and Semmes-Weinstein monofilament test of patients receiving electrical stimulation reached normal thresholds, but there were still abnormal values in patients receiving sham stimulation. And this is the first randomized controlled double-blind study showing improved functional results after electrical stimulation was performed to treat traction injury of the spinal accessory nerve in 38 cancer patients who underwent neck dissection. While the patients were under general anesthesia, electrical stimulation at 20 Hz and 3 to 5 volts was given to the spinal accessory nerve for 1 hour, while the control group didn't receive electrical stimulation. And in this study, Barber et al. Found combined subjective and objective scores for shoulder function after 1 year and significantly greater improvement in electrical stimulation applied patients than in control patients was found. In an updated double-blind randomized controlled clinical trial involving patients with severe cubital tunnel syndrome, electrical stimulation at 20 Hz and 30 volts was administered immediately after cubital tunnel decompression under general anesthesia for 1 hour. The control group was subjected to sham electrical stimulation also. And in this study, Power et al. Found a significant increase in motor unit count estimation after 1 year, and motor unit count of electrical stimulation patients was more than twice after 3 years compared to sham stimulation control subjects. And significantly greater improvement in both grip and pinch strength was found. So, this study proves that electrical stimulation is a promising adjunctive treatment option to peripheral nerve surgery to increase axonal regeneration and accelerate functional recovery. As conclusions, in addition to the fact that 1 hour electrical stimulation is effective in promoting motor axon regeneration, it has been stated that the same electrical stimulation period is actually effective in supporting sensory axon regeneration. And electrical stimulation was found to be ineffective in accelerating sensory nerve growth when the electrical stimulation time period was extended from 1 hour to 14 days. The fact that sensory nerve regeneration is often lower than motor nerve regeneration, both in the absence and presence of electrical stimulation, is effective in the formation of this condition. Studies also show us the practicality of intraoperative electrical stimulation application and the effect of 1 hour electrical stimulation protocols, but the application of 1 hour long-term electrical stimulation through hooked or ringed nerve electrodes is one of the important limitations of clinical use, especially for the physiotherapists, because hooked or ringed nerve electrodes could only be used intraoperatively. And it has been reported in the literature that the application of electrical stimulation in the postoperative period with multi-day electrical stimulation may have additional therapeutic benefits. Additionally, many studies in the literature predict that long-term continuous electrical stimulation may not improve regeneration, whereas when nerves are stimulated intermittently with short electrical stimulation, it may benefit regeneration and prevent neuronal damage due to excessive current. So we can say that electrical stimulation can be used in the denervated muscle healing in the first 21 days. And these are the references of this chapter. You can also review them. And I am in the end of my presentation now. Finally, this is the team of our project. It is a pleasure to be in this team, and I am very happy to make this presentation to you. Thank you for your attention.